Good morning, everyone. Gareth Presch, CEO, Global Social Prescribing Alliance, founder and CEO of the World Health Innovation Summit. I am absolutely delighted to welcome you to our 2026 Global Social Prescribing Alliance Summit. And what a day we have scheduled for you today. As we all know, we face enormous challenges across the world in terms of healthcare provision. And today we're going to have a deep dive into how we make this transition from managing disease to prevention at scale, but also looking very closely at the economic opportunities, and they are enormous. As we know, 80% of our health and well-being, the social determinants of health, are determined outside health and well-being as we know it, which is the hospital system. And what we're going to talk about today is how we mobilize financial means to support this transition. And just to put it into context, we all know about 12 trillion annually is invested in that 20%. So the other 80% is an enormous opportunity. And that's where we're going to focus today, our efforts and our energy. And you're going to hear from pioneers all over the world who are demonstrating how to do this. And the Global Social Prescribing Alliance, I mean, it's a collective. When myself and James came together in 2020, we had a vision where we wanted to bring people together to provide a platform which would allow people to flourish and to get those ideas, through the networks that we had and springboard them all over the world and provide a framework for governments, for local institutions to anchor into and to help them enable thriving communities and support social prescribing at scale. And today, we're announcing a number of papers, the G20 position paper with our friends around the world. And you will have the opportunity to engage face-to-face with us online. Pop in the questions. Don't forget to tell us where you're from this morning. So if you've just tuned in, first thing, pop in the chat. Where are you from? We anticipate we'll have an audience from around 50 countries, which is just fantastic. When we started this movement in 2020, there was just, a small number of countries involved. We grew it in 2 years up to around 30 countries, but now we're in excess of 50 countries. So it's a very exciting day. I have a short presentation that I'm going to go through just to set the scene. We also have a special awards today. We have 5 categories, 5 awardees. I'm really excited to share that with you as well. We'll take a deep dive into the digital aspect, AI, which is coming fast. How can social prescribing, embrace artificial intelligence? How can we implement artificial intelligence across social prescribing? And we have fantastic partners, Scalar 10, United Share, they're working with us. They'll be on the panel discussions later. So, make sure you tune in to that later on today. So let's me start off with just short, set the scene, give you an insight into, the work we've been doing and where we are going. Very excited, as I say. So let me bring up my screen. I'll publish this later today, and you'll have this available across the patch. And any questions you have, by all means, pop them in the chat. So firstly, a big warm welcome again. I know some colleagues are getting up early. We've colleagues in the US that are probably up at 3 o'clock in the morning on the West Coast, and then we've colleagues in Australia who are probably starting to go to bed. So thanks for joining us. We are this is a global convening for system change. All right, so really welcome. We're going to connect communities. We're going to transform health systems, and we're going to scale what works. That is the plan that we have ahead of us. So let's put things into context. We know health systems are under pressure, chronic diseases are rising, mental health is in crisis, and the workforce, we're just completely overwhelmed. To put into context, here in the UK, we've over 7 million people waiting for elective surgery. It's just, we've so much pressure on the health system. COVID has really exacerbated this and accelerated, the challenges that we face. The reactive healthcare system model that we have is just no longer sustainable. It's costing billions. It's impacting the economic growth as well. 7% of GDP in the UK alone. Health is wealth. This is a huge investment opportunity. I cannot stress that. Investors out there listening in, get in touch. We have a pipeline, a deal flow that we're going to work with, our partners all over the world. The National Social Prescribing Group that we set up in Norway, for example. We're stacking projects. We're growing this movement. We want to be a good force of change, work with investors all over the world to be able to bring that deal flow, to be able to crystallize that opportunity. We can create millions of new jobs here. So our mission is, proactive, prevention-led, system change at scale, health for all. We've been talking about it for many years. Now we have the tools and the means to do it. We want to empower people. So, that's going to take a lot of effort. We're going to need a big team, and we have to ensure we leave no one behind. I'm super excited. You've got so much resources here. As I said, today we're publishing our position paper. We've got the state of social prescribing as well. Huge report today. Make sure you download it. Make sure you take a look at it. And we have also published previously our playbooks, up-to-date versions, 2026. AI, digital health, and social prescribing. We're going to take a deep dive into that, as I mentioned later in the session. The future trends of value-based healthcare, well worth a look. Upcoming, just so you know, we have special interest groups set up now. These coincide with the chapters that we've set up all over the world. I had 2 phone calls this week, one for Luton and Nottingham, where we're establishing new chapters across the UK. And these are growing all over the world, in India, in Latin America, North America. So, Africa, we're really starting to scale this up. AI, digital health integration is going to be critical. I've already mentioned that twice, but we'll go more detail later in the day. So this is about scaling the vision and taking the opportunity because it's so big. Next steps for us: sustainable development, ensuring that the projects that we select, actually address the challenges that we face, and that need partnerships. It needs trust, it needs transparency, it needs integrity. So we're building that investment case, as I mentioned. We have a sustainable model which delivers an ROI for investors. Okay, these are projects that, whether it's governments through social impact bonds, we can deliver savings for the governments, or through private investment, we can bring in investment that delivers sustainable change, creates new and meaningful jobs while improving people's health and well-being. A special mention to some of our strategic partners. The G20 paper, for example, is with the Well Futures Alliance, the SVC Collective, which we've just pulled together recently in Ireland and growing. Freya Foundation, have to thank for the very kind sponsorship. Without their support today, this event wouldn't have taken place. United Share, Scalar 10, DJK Global, all, and there are many others involved in this. We are truly grateful for your support, and we look forward to working with you as we grow this all over the world. Next steps, I'm super pleased to sort of make these announcements. We've had Innovation Impact Winner Awards, and first of all, congratulations, thank you to everyone who submitted an application as well. 2026 awards are now open. You'll be able to nominate colleagues. But first, Innovation Award, Kate Shepherd Cohen, Menstrual Cycle Support UK. We're going to hear from these very shortly. The Changemaker Award, Just Nakan, Equality Primary Care Network. The Connector Award, the Norwegian Red Cross in Bergen, Norway. Researcher Award, SPLS Portugal. Fantastic job. And then the Student Champion, Ken Beller at the Quiet Hour Global. I also just want to say a big thank you to the wider team. It's very important to understand that all of this work takes a community, a wider team. I'm super proud to work with you as a team, as a group, as a collective. We really are connecting communities. We're transforming health systems, and we're scaling what work. I am super grateful for this opportunity as well. And we are on the cusp of a wave to be able to transition healthcare from disease management to prevention at scale. What I'll do now is, before I bring in James for his keynote, we'll have a few words from all the winners, and I'm super excited and delighted they can join us. We'll start with Kate, Justin, Roger, Ken, and Christina, and then I'll bring in James, and we'll get through James's keynote, and then we have a special announcement once James finished, to keep you on your toes, and then we will move on to the first session. So let's hear from Kate.
Hello, everybody. I believe that menstrual cycle support on social prescription has the power to transform not only individuals with a menstrual cycle, but relationships, families, communities, and society at large. I really struggled with my own cycle. I felt so alone, so dismissed in healthcare. So it is my absolute privilege to offer a menstrual literacy intervention using the social prescribing pathway. And what I love about it is that we receive referrals from across the system. So from school nurses right through to counsellors, GPs, and consultant gynecologists. I am deeply honoured to accept the Global Social Prescribing Innovation Award, and I would like to dedicate it to all of those who have ever felt alone with their menstrual cycle. Thank you.
Fabulous words from Kate, and now I'm going to bring in Justina.
Hello everyone, I am Justina Khan from Equality Primary Care Network. I am deeply honoured and incredibly humbled to be named the winner of 2026 Global Social Prescribing Changemaker Award. For the past 28 years, my life's work has been dedicated to one simple but vital goal: ensuring that no one is left behind because of language, culture, or systematic barriers. Every health cafe we host, every physical program we customize, and every connection we make through our digital network is about reclaiming health equity and building trust within our communities. This award isn't just for me, it belongs to every marginalized woman and family we have supported. You inspire me every day. It also belongs to all my mentors, work friends, and my amazing team. Thank you to the Global Social Prescribing Alliance for recognizing that localized, community-led care is not just a nice to have, it is the foundation for a healthier, more resilient world. Let's keep breaking down those barriers together. Thank you.
Fantastic from Justina there. And now I'm going to just bring in Roger from Norway.
I am honored and proud to accept this award on behalf of the Norwegian Red Cross in Bergen. Even though we have worked hard for several years to get to where we are now, we are also very aware that we are still at the beginning of a much longer journey. This award gives us an opportunity to pause for a moment and look at ourselves from the outside. The recognition this reward represents means that someone has seen real qualities in what we are doing when linking researchers with community volunteers. That is deeply inspiring, and we are honored to be recognized by the Global Social Prescribing Alliance for this award.
Thanks, Roger. Absolutely fabulous stuff. I hope you're getting an insight into the sort of opportunities, but the global context and the communities that we can touch on here through this work. Ken next, who's all the way in the States.
With Quiet Hour. Thank you, Gareth, and the Global Social Prescribing Alliance for this tremendous honor. Being named the Global Student Champion is an incredible highlight for our entire team at Quiet Hour and Nearbridge. I also want to share this recognition with my co-creator, Heather Chase. Our partnership has been vital in this mission. Actually, it was her who came up with this idea. With Quiet Hour, we ask one simple question: Why is it still so hard for people to assess nature's healing power? We realized the missing link was a practical, standardized tool. Our curriculum changes that, empowering students and practitioners to turn nature-based theory into immediate, trauma-informed care in under an hour. Whether it's quiet birdwatching, quiet art, or quiet walk, we're proving that you don't need complex equipment to facilitate well-being. We just need to give people permission to go outside, press play, and feel better. This award validates that we're moving the needle. It recognizes a future of social support without social pressure, and that is our greatest reward. Thank you for believing in this work.
Grateful to Ken there for sharing his fantastic work. And our final award is to Christina in Portugal, and I'll give her the stage.
Hello, my name is Cristina Vaz de Almeida, and I am the president of Portuguese Society of Health Literacy. And I would thank you so much to the Global Social Prescribing Alliance for this incredible recognition. On behalf of the entire team of Portuguese Society of Health Literacy, we are deeply honored to receive the 2025 Global Social Prescribing Researcher Award. As researchers, we often spend our days buried in data, metrics, and systematic reviews. But at the Portuguese Society of Health Literacy, we have always believed that data should never just sit on a shelf. It must serve as a bridge to a better quality of life. This award belongs to every researcher, clinician, and community partner who poured their heart into our program from steps to embraces, which idea came from the oncologist Vasco Fonseca. Our goal was simple, yet urgent, to build a rigorous systematic framework combining physical health and cultural integration specific for elder cancer survivors. We wanted to prove that health literacy and social connection are just as vital to recovery as clinical intervention. Seeing that academic data was translated with success into national policy, moving from steps to embrace directly into Portugal active aging framework has been the ultimate reward. It proves that when we back to good health literacy, health communication, and empathy with ironclad evidence, governments listen, systems change, and lives improve. Thank you very much to Gareth Presch, and also to his team, James, and the global GSPA community for giving our work a global stage. Let's keep proving what is possible when science meets community. Thank you very much. Muito obrigada de Portugal.
Thanks, Christina. What a fabulous way to start and kick off our keynote from James Sanderson. So I am going to pause now for a minute and just hand the stage over to James and enjoy. So thank you very much.
A very good morning, afternoon, and evening to all of the colleagues around the world. What an amazing lineup of people from right across the globe. It's been truly humbling seeing everybody put their comments in around where they're dialing in from today. And a huge congratulations to all of the winners at the starting of this summit. For all the social prescribing awards. So fantastic congratulations to Kate and Justna and Roger and Ken and Christina and all the teams that have worked alongside them. I'm delighted to get the opportunity to provide this keynote this morning in England, where I'm dialing in from. And I want to first start with an amazing thanks to all of you around the world for the brilliant work that you're all undertaking. I know that the work that you're doing is difficult. I know that the challenges that we've got in healthcare settings right across the globe are really challenging at the moment. And I know that we have a huge commitment from everybody around the world in trying to find ways of tackling the biggest challenges that we have facing us in regard to global health. And I just wanted to say a huge congratulations to everybody that's working in this field. You know, there's a lot of work that I know people do without reward. There's a lot of personal pressure. There's a huge commitment that people need to bring. And I think everybody on this call should be proud of themselves for wanting to make a change to the world, wanting to make a change to global health, wanting to tackle some of the significant health inequalities that we have in society and to make people's lives better. And that's something that everybody should be incredibly proud of. Now then, I only have about 20 minutes. So I'm going to start by looking at global health from 4,000 years ago up until the present day. So I'm not sure how I'll succeed within 20 minutes with that task. But I just wanted to mention one of the first leaps in human health and well-being, which was 4,000 years ago in modern-day Iraq, in a civilization called Mesopotamia, which I'm sure everybody is aware of, and in a city called Babylon. Now, 4,000 years ago, that community discovered that providing sanitation and clean running water was key to the health and well-being of the citizens living there. They also used nature to combat some illnesses and to enable people to live in an environment that created health at its core. Now, obviously, you know, that's a long time ago, and there's been lots of changes to global health. There's been lots of interventions. There's been lots of things during the course of the last 4,000 years. But I just wanted to touch on a few of those. If you think about it, what are the building blocks of good health and well-being? Well, I think that at its core, belonging, purpose, meaning in life, and having an activity to do are part of the core things that as human beings, we enable ourselves to create health. Feeling belonging, feeling part of a community, feeling that you have a purpose, feeling you have a reason to be is so important. And unfortunately, many people across the world can lack this. People can be disengaged from their communities. People can be isolated. People can be in a position where they're not able to connect. People also can lack purpose. They can sometimes struggle with knowing where they're going in life, knowing what their goals are. And many people lack activity. Many people lack the ability to have something in their day that keeps them going, that gives them a focus. And I think these factors are the key things at a simple level that social prescribing is trying to tackle. So a bit about my journey in social prescribing. Well, it's been a long one. In 2015, I entered the NHS after a 13-year career supporting disabled people and working in community work right across the UK. And I took on board the role of National Director for Personalised Care for the NHS in England. And one of the things that we looked at that time was the biggest problem with the fact that whilst we were living longer lives, we weren't necessarily living healthier lives. So we started by looking at life expectancy. And when the NHS in England was formed in 1948, life expectancy for men was 65 years and for women was 67 years. Then 70 years on, life expectancy had grown by 17 years. Now that's a huge leap in human evolution. If you consider that in the UK, life expectancy was around 40 years, in the 12, 13, 14, 15, 1600s, life expectancy didn't really move that much. You then look at life expectancy only started to climb up to 65 years during the 18th, 19th centuries. So a leap of 17 years in life expectancy over the course of 70 years was huge. And why was that? Well, there were a number of factors involved. Obviously, medication and modern healthcare was part of that evolution. In 2 years' time, we'll be celebrating the discovery of penicillin. But it's interesting, isn't it, to think of something as fundamental to health as penicillin, that is only 100 years old. Well, not even 100 years old yet. In 2 years' time, it'll only be 100 years old. Other factors improving health and well-being in England included seatbelts in cars being mandatory, health and safety legislation stopping people from having industrial accidents, and smoking cessation as well. So these were big factors in enabling people to live longer. We also obviously had modern medicine. We had techniques that were developed in surgery. But if you look at modern medicine, you know, it was not until 1974 that we successfully transplanted a heart, and it wasn't until 1977 that we had MRI as the opportunity to see what was going wrong with our bodies. So these are relatively recent interventions. So a huge revolution during that time. But whilst obviously medicine and drugs and healthcare techniques are incredible, we know that there are huge disparities across the world with access to even the basics of medicine. We know that even though my example of Mesopotamia and sanitation and clean running water is something that you know, was trialed 4,000 years ago, we know that sadly there are still communities across the world that don't have access to those basic requirements. So how can we solve all of this? Well, I think, and I've always believed, that we need a very different approach. We need a new approach that looks at health not from a purpose of what's wrong with people, but looks at people fully holistically, that looks at who they are, that also takes an innovative approach to how we solve the issue. So for the 8-year-old child that's living with a respiratory illness, should we look at prescribing salbutamol and steroids as something that is the default? Or should we be considering the black mold that's growing on the wall of their bedroom in their poor housing that they're living in, that's actually the cause of their respiratory illness in the first place? So how can we start looking beyond the person that's in front of us to look at truly what we need to enable people to live the best lives that they can? So what we did in NHS England with this challenge is we developed something which is called the Comprehensive Model for Personalised Care. And this had 5 key components because we realised that it needed a comprehensive approach to tackle the biggest health challenges that existed. So the elements of this were enabling people to have choice and control over the way their care was planned and delivered. So choice for an individual in healthcare settings was the starting factor. We then determined that people needed a personalised care and support plan. We needed to sit down and look holistically at people's lives, and we needed to give them the opportunity to say what mattered to them, and we needed to give the opportunity to find out all of the things that we could do that would support them living their best life. We then recognised that there was a massive gap between those with agency, those who could self-manage, those who had connections, those who were able to determine what they wanted to do, and those that sadly weren't. So actually self-management support and enabling people to have agency, giving people the opportunity to be activated, to have knowledge of their healthcare condition that they're living with, was really important. So, you know, if somebody's newly diagnosed with type 2 diabetes, we can give them medication, we can give them support, but actually, why aren't we making them experts in their condition? Why aren't we giving them the knowledge to fully understand what is going on with their bodies? So self-management support was really clear. We also introduced something called personal health budgets, which was enabling people actually to take control of the resources available to them, to create their own care packages. And finally, the 5th thing in the comprehensive model for personalised care was, of course, social prescribing. Social prescribing then was the notion of a simple connection, the ability for somebody to be connected to social activity that could create the shifts that they needed in their lives. And what we then did is we took this model around the whole country. We developed communities of practice in all 42 care areas that there were at that point across England. And we developed champions in each of those areas. And I'm immensely grateful to all the people that worked in that early pioneering of the comprehensive model to really scale this locally. And we then, in 2019, we then put this plan together as part of what was called the NHS long-term plan. And that long-term plan was a significant moment for social prescribing in the UK. It was the first time that a global health community had put into its healthcare system the opportunity for psychosocial support to go alongside biomedicine. And that was a huge step. Actually having psychosocial support recognised as part of government policy was huge. And the government in England also committed to £350 million being embedded in the healthcare system to support the development of a link worker network, having people sitting in general practice at a local level who could provide the opportunity for people to connect to social activities in their community. And I'm immensely proud of all of those link workers that then came towards social prescribing in the UK, many of them stepping in to a world that wasn't yet created, many of them being pioneers in their own local areas, to sit in general practice, isolated sometimes from the wider healthcare system, to look at working with individuals to transform their lives. And we developed this model really rapidly. So by 2024, when I left NHS England, we'd supported over 10 million people in the delivery of the comprehensive model for personalised care. And we had at that point 3,500 link workers across the country who were actively delivering social prescribing on a day-to-day basis. And this was a huge achievement. In 2019, I also had the privilege of working very closely with the Secretary of State for Health and Social Care, Matt Hancock, on the development of the National Academy for Social Prescribing. He had a vision that actually we needed an organisation outside of the healthcare system to champion social prescribing. And we built this from the ground up. And I'm really grateful to Professor Helen Stokes-Lampard and Bev Taylor, who worked with me on the early days of developing NASP. And then in 2020, Gareth Presch and I, after the launch of NASP, began discussions on how we could take this initiative global. And Gareth worked with the World Health Organization and the United Nations GSPA Institute in order to bring those two organizations together with WHIS and NASP to create the Global Social Prescribing Alliance. And I just wanted to pause and just pay a bit of a tribute to Gareth, who's the person that's brought us all together today. Gareth has worked tirelessly over the last 6 years, developing the opportunities for global health. I know that for lots of personal sacrifice, Gareth has spent many hours traveling the world, talking to people about the benefits of global social prescribing, about the opportunities that come from connecting communities together and the opportunities to transform global health. And I think we should all be grateful to Gareth for the work that he's done in this area. So we established NASP. We worked with informal networks that existed at the time, but our idea was to scale the opportunity for connection on a global footprint. The idea was to simply bring people together, share knowledge, share learning, share experience across boundaries, and create the opportunity for these shifts that we'd seen in England and across the world to happen everywhere. And what has been amazing for me about this global social prescribing community has been the fact that we've recognized that despite different cultures, despite different economic situations, despite different challenges, we are united in the opportunity that comes from bringing communities together for social prescribing. We realize that actually across the world, we're not very different. We realize that actually there's a way of uniting communities with the challenge that we all want to do our best for the people that we live with. We all want to do better for all of those people that are suffering. We all want to do better for those people that are facing inequality. And that is a universal dream that unites us all. And I think this is one of those really great opportunities that we have together to bring the world together, despite, you know, many conflicts and many issues, to actually deliver something that's purely transformative for individuals. So where next? Where next with social prescribing? Well, on Social Prescribing Day earlier in this year, I reflected on the things that need to be part of social prescribing as we move forward as a community. And I came up with 5 key things: personal, inclusive, collaborative, ambitious, and simple. And I'll just talk about those 5 key things very, very briefly. So personal, it still needs to be grounded, I think, in personalized care. It needs to be grounded in a wider approach to how we enable individuals to be seen in healthcare settings. How can we ensure that people are still at the heart of everything that happens around them? Secondly, it needs to be simple. This is about a connection. This is about an activation. This is about finding something, whether that's knowledge and learning, whether that's in arts and culture, whether that's in sport and exercise, whether that's in nature. We need to find something that works for people, something that people will enjoy, something that people can connect to. But we don't need to overcomplicate it. You know, at its essence, this is about simplicity. This is about finding the easiest route to good health. Thirdly, it needs to be inclusive. Social prescribing is about everybody. And actually, as a global community, we need to make sure that there's no exclusive clubs or hierarchy. Everybody on this call today, everybody that's working in social prescribing is just as important as everybody else. Social prescribing is something that should be a universal element that we can all embrace, and we can all get involved, and we can all connect with. Thirdly, it needs to continue to be collaborative. This is about breaking down organizational barriers, not just on a global stage, but nationally as well. Within every country, we see so many barriers between local health systems and national health systems, between the charity sector and the statutory sector, between private business and the way in which things interact in society. And actually, those barriers always create problems for health and well-being. So we need people to come together if we're truly going to transform health. As in my example of the 8-year-old with respiratory condition, you know, we need housing, we need local government, we need the health service, we need the private sector to work together to fix those issues. And the benefit of that is that we know that if we do that and we fix those issues collectively, we'll be in a position where, fortunately, not only do individuals benefit, but also the cost to the system reduces. And finally, we need to continue to be ambitious. Social prescribing, you know, started, and the global social prescribing started with this huge ambition that we wanted to transform world health. We can still get there. We don't need to bring this to a position where we're starting to think that maybe we need to limit our ambitions. We don't. We always need to think hugely ambitious. This is the greatest challenge that we face, fixing global health. And there's a great opportunity using this as a mechanism to do so. So whilst my social prescribing journey will never end, you know, it's something that's always going to be close to my heart. I want to announce today that I am stepping down from my role as chair. This is after 11 long years and huge joy of working with people right across the world in the delivery of this fantastic venture. But I feel that after supporting social prescribing and doing the work that I've done over the last 11 years, it's time to hand the baton for the Global Social Prescribing Alliance on to somebody else. And I've also got more challenges in my new day job as Chief Executive of Sue Ryder, which is a national palliative and end-of-life care organisation. I want to do for palliative and end-of-life care what I've done for social prescribing. I've got a real ambition to try and fix some big issues in the way in which we die and how we can support people. So now it's time to move on. And I wanted to just finish by thanking a number of people that have been on this global social prescribing journey that may rarely get mentioned. But in NHS England, Ian Dodge, who was the National Strategic Director, really believed in this model. To Matt Hancock, former Secretary of State for Health and Social Care. And then my team, Nicola Kay, Nick Gitcham, Rich Watts, Jenny Walker, Joan Murray, Danny Wood, and Jasmine Pearson, who all helped me in the delivery of social prescribing in the early days. Thank you to you all, and thank you to this global community. And I'll now hand back to Gareth Presch for an exciting announcement. Gareth.
Thanks, James. I can personally just say it's been like such a pleasure to work with yourself over the last 6 years since we started this journey. I was always amused by your photographs of hotel rooms, and that's how I began to get to know you when we first connected on Twitter. But it's been a real privilege, and as James says, he won't be going too far. His journey is certainly not finished. And I just want to also say I'm very grateful to James and his team, the individuals that he mentioned there. Richard at the start, I know myself, Richard and James spoke initially in 2020 about the sort of vision behind the Global Social Prescribing Alliance. So without the team, nothing happens. On that basis, James has set out like a fantastic vision, and I totally agree with him. We have to be ambitious, and we got to keep it simple. And we got to engage communities and make sure it's not an inclusive club. On that basis, I want to announce our new chair and bring the new chair onto the stage. It's Dr. Patricia Welch-Selby from the USA, and she's up nice and early. So Patricia, very welcome. We are delighted to welcome you to the community. And I would love to hear your words of wisdom, having joined us this morning, and perhaps you could just say a few words to the audience. And you're very welcome, and we're looking forward to your tenure.
Thank you so much. Can you hear me?
Yep, go ahead.
Yes, excellent. Okay, it's very early here in the morning in the US. Thank you, just everyone. I am deeply honored to step into this role of chair for the Global Social Prescribing Alliance. There's some big shoes to fill with James's departure. So first and foremost, I want to express my gratitude to Gareth and James for their exceptional leadership, visionary guidance, which has really brought us to this pivotal moment. Also thank all the global partners and community champions. This really is a community for their dedication in turning this shared vision into a daily reality. I'm a social worker. My career entirely has been rooted in a deep understanding of social determinants of health. So I know firsthand that a person's environment, their wealth or lack thereof, their social connections dictate their health long before they ever see a health professional. So the relevance of social prescribing has never been clearer. Healthcare, we know, is changing. We've heard it already from the comments by Gareth and James earlier. And we now recognize that true well-being and human flourishing extends far beyond the walls, right, of a doctor's office or a community clinic. And by addressing those social determinants of health, social prescribing bridges the medical care with those necessary local resources, the arts, nature, and the peer support that is required. Social power, or social prescribing, really empowers individuals, and it gives them tools, it gives them agency to co-create their own health journeys. And I think that is the magic, if you will, behind social prescribing. So as chair, my priority will be to work with Gareth and James, who will not be too far, as he mentioned, to really scale our global impact, to strengthen those cross-sector networks, and ensure that social prescribing becomes a standard pillar of healthcare worldwide. So I look forward to working alongside all of you to build healthier, more connected communities. And I thank you again for this great honor and privilege.
No, it's an absolute pleasure. And I want to bring up just some of the comments, because we've got a lot of comments that I haven't had a chance to bring up on. But, we've people joining us from all over the world: Dubai, UAE, Austria, Penrith here in Cumbria, locally to me, Cameroon, West Africa. Some messages of support for Justna. Congratulations. It's just some more messages. I want to make sure. Thank you to James. Absolutely. Thank you, Gareth. Congratulations, James. Lots of messages here. We'll try and bring them up. We're just really grateful for all the support. We've got a cracking day ahead. Messages of support for you, Patricia. Lots of people. it's just fantastic to see all this. I mean, please do message, get involved. As I said, this is a community that we're building. It's for everyone. Again, Netherlands, fantastic. James, maybe just a few words from yourself. I appreciate, the difficult decision and the difficult choices that you've made, but do you feel optimistic around the future of social prescribing and given where we're at this moment in time?
Thank you, Gareth. I'm reflecting that next year marks my 25th year after a previous career that I was in, which was quite different. But 25 years in health and social care, and really, the thread of that has been tackling inequality. Whether that was supporting disabled people to live independent lives, or it was in their health setting, and now supporting people at the end of life, having taken over at Sue Ryder 2 years ago. So it's been a long journey, and I've seen lots of movement forward. I've unfortunately seen lots of movement backwards during that time, as inevitably you do. But I am hugely optimistic, and the reason that I'm optimistic is, because of what today demonstrates. When you go down the list, I was making a list, and then it took over my ability to write all the countries down, seeing Sweden and New Zealand and Portugal and Germany and Italy and Scotland and Luxembourg and Calgary and Burundi, Denmark, Netherlands, Florida, Singapore. A huge opportunity of people coming together across the world. And when we have that commitment of people, and I recognize a lot of the names that are in the chat and have joined us. I know the brilliant work that's going on at a local level, and when I hear the stories of transformation, when I hear the opportunities that we've got, you can't help but be optimistic. I think the thing that we all need to remember is that a lot of health systems and a lot of the challenges that we've got will work against us, and I think that's something that is important for this global community, because all of those barriers that we're all facing are universal. So actually coming together and realizing that there's colleagues that have perhaps overcome one of those barriers, that have found ways around it, that have found opportunities to work through it, is how we can keep going together. And World Health is huge challenges face it. And we know that the demographic shifts that we're going to see over the next 10, 20 years are going to be significant. And we know that we have solutions that can make those shifts more bearable. So we've got to continue with this movement. And I am, so delighted by the new chair coming on board with Patricia, because recognise the amazing work that you've done, Patricia, and I'm so excited for where GSPA will now head. And for you, Gareth, the work that you've done has just been incredible. So yeah, let's have that ambition now.
Absolutely. I think just the point you made there about resistance to change, and that is very interesting, because later on today we've got like a session around kindness. And believe it or not, I actually think that this is a key part of it, is being kind, being respectful, but also very much about the integrity and the values. I gave a lecture during the week to human flourishing at Harvard, and we touched on this. And the very first point I made, because I was linking the work we are doing in healthcare and how that can be a driver for human flourishing. But the very first point, my very first slide, was around having values and working with honesty and integrity. And I showed that as the first point, because you also you can be very kind, but you have to have boundaries, and they have to be respected. And I think that's a crucial point if we are going to achieve what we need to achieve. And I think that being kind is not a weakness, that's a strength. In many respects, it's been exploited. People who are kind and do this type of work are generally exploited. But that has to change, because kindness is a superpower, in my opinion. And having that empathy and integrity is important, in particularly around health and well-being, particularly the trust that's given to the health service. People entrust us to do the right thing and they also trust us with their lives, you know, and their families' lives. So it's so important. I mean, I learned that at an early stage, having worked with my mentors, Professor Bonner and others. Such an important point. Now, we've come to the end of our first session, and I'm super excited to welcome you to the global context just after this, where we'll have a roundtable with a number of key stakeholders, including Park Run. We'll hear all about Park Run and the phenomenal work that they've been doing. So do tune in 10 minutes. We'll be back online. I want to just give a final words from Patricia first, and then James. I think it's only appropriate that you close it out this session, given the immense amount of work you have done personally over the last 11 years. So Patricia, just a final word to yourself, and then we'll see you later as well, because you'll be joining one of the panels this afternoon. So over to you, and then we'll let James close out.
Sure. I'm just, again, very, very grateful for this opportunity. I am looking forward to working with the expanding group of partners that we're having across now, 40 plus countries, which is remarkable. As James mentioned, looking through the list of countries, so impressive, and the people recognizing names, but also not recognizing names, right? New people who are coming aboard every single day, believing in this mission. And one of the things that I think is so striking is the fact that people are already doing social prescribing. They just don't necessarily call it social prescribing, but they're doing it. It is something that can be easily transferable, if you will, or translatable into everyone's daily practice and lives. So I'm just really excited to go on the next step of this journey with you, Gareth, with you, James, and everyone else here who's joined us today. So thank you again.
Thanks, Patricia. James, final words for you. We'll let you close out the session.
Thank you, Gareth, and thank you, Patricia. Look, three things from me to close out the session. Firstly, be proud. Be proud of everything you've all achieved so far. Amazing examples, not just the winners today, but everybody is a winner in terms of the work that you've all done. And, you know, as Patricia was saying, this is about everybody and new people coming in. You know, we should all be proud collectively and on an individual basis about the achievements. So be proud of what you've already achieved, and thank you all so much for everything you've done for people right across the world. Secondly, be confident. I think, you know, this next push, the challenges that we face in global health require confidence. It requires the ability for people to have that vision, to have that determination to succeed, to have that determination to change the things that are wrong in the world. So be confident in the strength of this community and the opportunity to move forward and achieve some fantastic things. And finally, keep going. It's a long journey. It's a hard slog. And I know it takes a huge personal commitment, but keep going. It will work. It will happen. And I know that between us, we can make a difference to people's lives, which is all it's about. Thank you all very, very much for joining me in the part of the journey that I've shared. And I'm not going anywhere. I'll be keeping a watch. Thank you.
Thanks, James. I'll just bring up a few last comments just so people can see them. Thank you for the foundation. Nottingham is ready. Awesome. Patricia, congratulations to everyone. These are all people all over the world. Super stuff. Thanks a million. Beirut, Lebanon. So we'll end it there. We'll see you online in 5 minutes for the next session. And thanks, James, and thanks, Patricia.